The goal of palliative care is not the cure of chronic or terminal illness, but to provide comfort and the highest possible quality of life. Dr. Regan-Douty discusses the team approach at Redlands Community Hospital.
You know, the true sense of palliative care is dealing with the symptomatology, nausea, vomiting, constipation associated with treatments. And some patients have the goal of continuing treatments for these potentially life-threatening illnesses. I think it's a tremendous benefit. Not only to provide symptomatological relief of some of these things, but we also help engage the patients and the families with the care of some of these problems. We realize that nausea and vomiting can be controlled, and there's a tremendous benefit when you can actually take care of these things. Because when patients feel better, especially with illnesses that are potentially life-threatening, they sometimes go on to strive for more therapy or more curative practices. The team starts off with the patient, and the second most important is family and friends. And that's the largest focus, is the family unit and the friends. And then we have the professionals who are the physicians, nurses, LVNs. We have social workers, physical therapists. We also have clergy on staff available 24 hours a day. Volunteers, we have individuals in the community that choose to help with palliative care patients. The team is all-encompassing, and in fact there is actually no one excluded from it. The patient's the captain of the team. I work for them. The team reports to me. We do home visits. In fact, very few times are patients seen in the office. That's not our goal. So we actually have a luxury that we don't have really time constraints. We see patients during lunchtimes, we see them on Saturdays and Sundays, and so we have the luxury of time from that. But no, I'm not the captain of the team, I'm just one of the players. So the most traditional base is the cancer patients, end-stage HIV, end-stage cancer, where they've gone through chemotherapy, they've gone through surgery. Chemotherapy wasn't successful, and unfortunately those continue to be our largest source of our patient population. But we deal with end-stage lung disease. Patients have bad emphysema to the point where they can no longer walk. We have the progressive neurological diseases such as Parkinson's and Alzheimer's. We are not treating the disease. We are treating the whole patient. And unfortunately, some of these patients who have end-stage cardiac disease are not able to be treated by medications, are not able to be treated by surgeries. When they walk 5 or 6 feet, they get chest pain, they get short of breath. It comes to the point where they can no longer function. And you talk about the success rate of the service. We provide that patient with what's important to them, because as patients become more aware of their situation, they start to realize what's important to them. I don't want to be short of breath. I don't want to be a burden to my family. I want someone to help take care of my loved ones when I'm not around. And the goals change very differently. I don't want to be chest pain free, but I want to be comfortable. And that's how we measure our success rate. The medicine is not the biggest component of palliative care or hospice. It's the compassion of the individuals. You don't go to school to become a hospice physician. You don't go to school to be a hospice nurse. It's difficult. Dealing with death and dying is not a goal of our educational system, but it is part of our system. And one reason that drew me to it is I have patients who succumb to their diseases, and I never want them to be left alone. And unfortunately in our society, when patients can no longer come to the doctor's office, the doctor will not make house calls. They don't visit those patients, and that's disconcerting. And that's one thing that drew me to hospice, is I have the ability to do home visits. I do 5 to 10 per month on average for our sickest patients, and it's the biggest reward I can absolutely have.